Yeah, whenever I was a student, she was like, "You're with me," and I was like, what? Did I do something?" She's like, "No, I just had surgery. I trust you." And I was like, "Okay."
I was at the outpatient center. I love it over there.
Oh, that's where you're at?
Yeah, I love it.
That's where I'm starting this week. I'm like, oh, yeah, we should,
Don't be. And they're really cool. Trudy is super nice, but she's very straightforward.
she just wants you to like, I feel like a lot of people want to get it.
She wants you to have common sense.
Okay. Well, we can.
There's no sugar cookie.
There's got a lot of chest. We got a lot of upper GI series. Because there's only in the opposite center, there's only 3 times for fluoro. It's 9, 10, and 11. And then there's like 2 spots for speech. And then they do a lot of just. They do yeah.
Oh, modified
Yeah.
swallows. Okay.
That's cool. So I did in the second. Yeah,
People will just walk in because it's the Indiana, so there's cancer center. So they send a lot of patients down there. But for the most part, it's pretty quiet. Yeah.
That's what can affect a lot of
Ethan and Cheryl are not here. So
So I know that they said we're so expensive, but some people, I don't feel like we want to be able to.
what are you talking about for next semester?
Like,
Oh, there will be. We're working on it, but a lot of clinical facilities are right now still not taking students.
there's more available eventually, like different.
Hopefully, I'm trying to help them do that, and then I'm also trying to help with like possibly changing times. Like,
Yes.
7:30 to 8:40. That way, you guys can see like what happens in the evening in the ER, and like,
we can touch a protocol. Oh, we've gotten. Yeah, so she would exist.
I think that's everything.
Yeah, so here, we can go to the AAU. We can go to anywhere.
This is weird.
Yeah, so like I'm trying to get him to like ask town center if at least one person can go there and like play, and hopefully Memorial by springtime will take more students than just 4 right now, because that's what happened. Like 10 people were supposed to go there and they're like, oh, we can only take 4. And then if we can get split shifts, I think South will be willing to take on more people. But you guys, in clinical setting, do your best to just be a student, okay? Like, there's been some issues arising at South, and I work there, and I hear about it on both levels. Like, I'm your teacher, but I'm also an employee. So just do your best to just, you're a student. We've all been through it. I went through it. Sometimes clinicals are not fun.
Yeah, so I know what to avoid too.
Yeah, like, just be a student. If they tell you did something wrong, you did something wrong. Just, you're not the tech. So regardless of what happens, like, or if you're comping, don't ask questions when you're comping, because that's your comp. Like, you're supposed to know what you're doing. Once you comp something, you need to do it all the time. You don't just comp it and be like, all right, well, I got my test, cool. Like, no, you have to practice. Like, they're going to expect you. Like, they're like, well, you comp chest. Why aren't you doing a whole bunch of chest x-rays? Like, at that point, you show them that you know what you're doing. So you should be able to do them in the future. And the tech's just going to be like, all right, come get me when you're done, and I'll check your films before your patient leaves. That's how this works. So don't just be like, okay, cool, I got a chest, and then just, I'm done. You know, that's not how that works. So just make sure you have to keep practicing. You can't just do it one time and just be like, okay, cool, I'm calling this quits, kind of thing. So, and I don't know what's happening at the other facility. I haven't heard anything. So just, sometimes it sucks to be a student. I was there, you know, but it doesn't last forever. You don't have to like everybody that works there. Not everybody likes students, as some of you guys have probably seen. So, and they're also not there to like, not every tech is going to sit there and tell you exactly what you did wrong or how to fix things. And you just kind of have to roll with it. Just be like, every tech is different. Some techs hate students, some techs like students, some like you'll meet Dario at Baptist South. He would teach if he didn't speak mostly Spanish. Like it was like a language barrier, I guess. That's why he doesn't teach, but he's great. He loves to teach you guys, but somebody else at South might hate teaching you guys and want to avoid you at all costs. So like, it just happens. Like, you just have to kind of roll with it and just, you take it for what it is. Okay. And also, like, these facilities get super, super busy. The techs are super busy because they're the techs. So if things get said wrong, it's probably not because it's you. It's probably just the stress that comes along with it. So yeah, don't take stuff to heart. I promise you probably just got caught in the crossfire. You know, they're probably not meaning to do it. They probably don't even realize they do it. So just don't take it to heart. So unless they've asked you, and like, if you cause problems, they can ask you to leave. You don't have to be there. It's a privilege to be a student. So just kind of heads up going into spring. I know we're almost done with fall, but just try your best to just be a student and be like, that's it. Do you ask a lot of questions? Oh. Oh yeah. I tell everybody about your emails.
Yeah.
Oh. So like a lot of places, KVP and Mass is already going to be like, it's already programmed. You do need to know how to manipulate your techniques because like not every patient's the same, especially when you do portable stuff. So they're like already programmed for the ideal patient, but they're not necessarily. Like if you don't know how to manipulate your techniques, if you go to shoot like a NICU, you can't shoot every single baby at the same Mass and KV. It'll fry them. So, but and then like imaging centers, a lot of them don't have AEC. Like the urgent care that I work at doesn't have AEC, so you have to know your techniques. So unfortunately, that's kind of like I actually got really good at it because my first real job was in I did film x-ray for like a year and a half, and we had AEC, but you had to like pay attention to what your techniques were that it pulled, because if you had to change something or like repeat it, you had to know what it gave you the first time. So then you kind of, it just over time, you realize like and it'll start clicking with you guys too as we move into extremities more, like the thickness of the density thickness, like your KVs go up by like 10s, and then you'll realize like masses kind of correlate with them. You'll start getting it more as we go through the program, but you'll get really good at it once you're a tech. So maybe, yeah. Technique is your masses and your KVs, like how they affect one another. You guys have already learned, like, I guess that's how he's going to teach physics. He teaches physics, so I don't know what his. Oh, okay. All right, guys, so we're gonna go ahead and get started. Looks like just about everybody's online. Yeah, so 2 students are pretty much dropped out of the program, so that looks about right. Well, Rochelle, she's dropping out anyway, so she doesn't really attend my online stuff. And then Mary, yeah. So everybody else looks like they should be online. So 1, 2, 3, 4, 5, 6. Or actually, that's only 28. I'm missing Cheryl should be here this morning. Ethan already texted me and told me that his car battery's dead. He's online right now, though. So, okay, well, we'll go ahead and get started. So we're gonna move into like the fun stuff, or like the stuff that usually do as a student during X-ray. It's just when somebody has a fracture, I feel bad for them, but at the same time, some of them are interesting. Some of these, I don't know if anybody looked at it ahead of time. Some of these are actually my personal X-rays I've taken. So I always try to take an image of like something that is like unique, without obviously any patient identifier. All right, so we're gonna start with like just generic, like essentially like bone pathology. Bursitis is your inflammation to your bursa. So make sure you're like, when we're going over this stuff, because I've already created your test. I definitely need you guys to study these images. I need you guys to know pretty much all the way through all of your images. Half of it's going to be in this room via PowerPoint, half of it's going to be paper in another room with Mr. Graham proctoring. Because remember, we're doing chapter 3 or the 3rd test on campus. So you're going to be scheduled because they still like I think he's trying to find a room where I can get at least like half of you guys at once. So hopefully it'll just be 2 groups, like 16.
Okay, so one group is going to be looking at.
It'll probably be you guys start with me and then go to him. So the first group would start with the PowerPoint, then go to him for the written, and then the second group will come in while y'all are taking the written. I'll do the PowerPoint with them, and then I'll probably proctor the written for them, depending on how many groups we have. If there's 3 groups, then obviously it'll just go in that order.
How long do we have to answer to look at the PowerPoint?
I think the PowerPoint images I either am going to schedule in 30 seconds or a minute. Yeah, because like the top is going to have the question and then it'll have the image. So
for that one, we'd be like identifying anything or naming what it is.
It'll tell you.
Okay.
Yeah, and it's going to be pathology. It's not going to be anything that we've tested on so far. So this is the only test where there's nothing from previous sections. It'll be just whatever we're doing in this in the slides that we've covered the last 3 this class and the last 2 classes. That's it. So make sure you study them fully. Make sure you know and understand these definitions on here too, because that's going to be the written portion. Okay. And hopefully your final will still be online. I've talked to Smarter Proctoring on the phone and figured some stuff out that I didn't know anything about. So it'll hopefully go smoother for the final. All right, so bursitis, inflammation to the bursa. So your bursa are your fluid-filled sacs surrounding the joint. So this person probably hit their elbow real hard, and so their bursa is completely inflamed right here. That's why it's a big chunk of soft tissue. This is a good example as to why you'd never cut off soft tissue on an X-ray, because things like this happen. I have X-rayed somebody that literally their elbow looked like that, and it was just the bursa. It was super inflamed and bad. There's a lot of nerve endings that go through there.
What does it look like from the outside?
It literally looks like just a big ball.
Yeah.
Yeah.
It hurts really bad.
Yeah. All right, osteoarthritis. We kind of touched on this some chapters back. This is where you're really going to see it. You'll X-ray a lot of people that have osteoarthritis, so it's pretty much just loss of joint space. Obviously, like this image would not be on your PowerPoint portion, just because I can't get rid of all this writing and stuff. So narrowing of joint space with periosteal growth in the joint margins. So normal bones, that's your normal knee. If you haven't taken a knee X-ray, that's what it would look like. this is what happens when they have osteoarthritis. That's why people complain in pain, because that whole joint space is now bone to bone touching each other, rubbing. Osteomyelitis, you'll see a lot of this. A lot of inpatients have it. I mean, heck, my patients have it at the vascular center when we place PICC lines. 90% of them have osteomyelitis. It's an infection in your bone. So your bone starts off relatively like that, and it eats away over time, and eventually just disappears. Your whole bone's gone because an infection has eaten it away. They try antibiotics. A lot of people get PICC lines where the PICC line's in for like 6 to 8 weeks of antibiotics versus like an IV constantly being stuck with it. Some people recover quickly. Other people, eventually they just have to get the toe or foot or whatever amputated. It usually happens in the feet too. Huh? Yeah, usually older people, like 60 plus. I mean, I've never seen kids with it, but you'll see a lot of inpatients that you'll do x-rays eventually in your career, even as a student that have osteomyelitis. They'll always be like wrapped up with like gauze and ACE bandage and stuff.
Someone on the thing said, asked if you could straighten up your laptop.
Is that better, hopefully? I don't know. There's a big glare on the screen is the problem. Hopefully that's better. Elevate it. I don't have any way of elevating it, Ethan. Put it on the turbo. I think because the bone is white, it's picking it up weird. Let me borrow your book. I get it like exactly. Yeah, it's just the lights reflecting off the laptop. Ooh, I think that made it worse. Leave it like it was because the lights and the color of the screen. Why not? Yeah, I tried to turn it off. The slides are in the computer. That is the computer.
No, I mean like online.
Oh, I don't know. You think that they would?
Half the screen of you.
I agree.
It's not that. It's over there somewhere.
Yeah, it's by the door.
Yeah, the light switch on.
Oh, wait, there you go. Turn the other ones on. Yeah, I don't think it's gonna make a difference. Actually, it's probably worse. Oh god, that's worse. All right, y'all. Sorry, the bones are white on here. So, okay, well, I don't know. Per Ethan, it's better. It looks like a bunch of white mush on the screen, but all right, I'll roll with it. Y'all say it's better. Try to pull your slides up at home. I don't know what else to do.
Yeah.
I don't know. Okay, so anyway, so we're moving on to osteopetrosis. So it's different than porosis. So just look at the endings. So petrosis, it's marbleized bone, loss of bone distinction, obviously. So your bones don't want to look like this. Is obvious, like this is a blown up image too, so it makes it a little bit harder to see. But if you shot pelvises, your bones don't look like this. They're more defined. And obviously like in anatomy books and stuff. And obviously this one right here has completely lost the shape of the head versus the trochanters off the side. So just remember osteopetrosis, marble bone is the best way. It kind of, everything starts forming together. And it's bone thickening too. Osteoporosis, which is different, is where the quality or quantity of the bone is depleting. So the bone is starting to thin out. You can see more through it. So petrosis, it's gaining density. Porosis, it's losing density. This happens to a lot of elderly people too. This is usually why they break their hips and stuff, because they have osteoporosis. Their bones are thinning, so a slight fall will cause them to break a hip easily. So, all right, Paget's disease. It's mixed area sclerotic cortical thickening with radiolucent lesions. So cotton wool appearance is pretty much kind of what you want to keep an eye on. So it looks like cotton, kind of looks like that wool, like the stuff that you would clean your sink with. Remember those like silver wool things? That's kind of what it reminds me of whenever I look at it. And obviously it causes a lot of pain, so your femurs are pushing into your pelvis. It can happen anywhere in your body, but these are really ideal areas where it usually happens the most, which is why we have these images. Guys at home, hopefully you guys can pull up your PowerPoint on your computer and follow along. This is, the laptop is not showing you a good quality image from what you guys can see. All right, rheumatoid arthritis, you'll do a lot of these x-rays. Baptist South outpatient area, they used to send rheumatoid arthritis patients to us all the time. You're doing like bilateral everything because we're comparing both hands. So normal hand, everything's nice and healthy. Rheumatoid arthritis, it usually affects the metacarpals. So you're usually going to get some subluxation, which is like slight dislocation, and then the closed joint spaces. So the arthritis causes the joint space loss, but then the subluxation is like the slight dislocation. So everything's kind of pushing into each other, and it usually causes a deformity in their